Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Snoring Signals Heart Danger. And trust me, it's juicier than your cousin's peach cobbler. Listen up, folks. That chainsaw symphony your partner's cranking out every night isn't just ruining your beauty sleep, it's your heart's fire alarm going off at full blast. I'm talking about snoring. And if you think it's just an annoying habit, you're about to get a wake-up call that could literally save your life. Tonight, we're diving into why this common bedroom nuisance predicts heart attacks better than most medical tests. Yep, entirely true. I can't make this stuff up. Let's talk about the elephant in the bedroom, or should I say the freight train. Snoring often signals something called sleep apnea, which is basically your body playing a terrifying game of red light, green light with your breathing all night long. Every time you stop breathing, which can happen hundreds of times per night, your blood pressure shoots up like a rocket and your cardiovascular system gets body slammed harder than a WWE wrestler. Here's what I tell my patients. Imagine your heart is like a hamster on a wheel, and instead of getting to rest at night like it's supposed to, somebody keeps poking that little guy with a stick every few minutes for 8 hours straight. That's what sleep apnea does to your ticker. Your heart is working overtime all night, pumping against skyrocketing blood pressure, never getting proper rest. It's like asking your heart to run a marathon while someone's randomly cutting off your air supply. Not exactly a recipe for cardiovascular success, if you know what I mean. Now, here's where things get scarier than a Stephen King novel. Sleep apnea cranks up your heart attack risk by 30% and stroke risk by a whopping 60%. Think about that for a second. We're talking about better odds than Vegas, and the house always wins. Every time your oxygen levels plummet during these breathing interruptions, it triggers inflammation throughout your blood vessels like setting off fireworks in your arteries. This leads to irregular heart rhythms that make your heart dance like it's at a disco nobody invited it to, sky-high blood pressure, and arterial damage that accumulates faster than interest on a credit card. The real kicker, most people ignore snoring for years before seeking help. They treat it like that annoying neighbor who plays music too loud, just something you learn to live with. But your cardiovascular system isn't learning to live with anything, it's slowly dying. Let me tell you about Tom, a 52-year-old teacher whose wife complained about his snoring for 3 years. This guy's snoring was so loud the neighbors 2 houses down were wearing earplugs. Tom kept brushing it off, saying, "Honey, at least you know I'm still breathing." Well, that joke stopped being funny real quick when chest pain sent him racing to the emergency room faster than a cat with its tail on fire. The sleep study results were absolutely terrifying. Tom had severe sleep apnea. His oxygen levels were dropping to 70%, which is lower than what you'd find at the top of Mount Everest. This man was essentially climbing Everest in his sleep every single night. After 6 weeks with a CPAP machine, not only did his snoring disappear completely, but his blood pressure dropped 20 points. His wife got her sleep back, and more importantly, Tom got his life back. Maybe I should see some of you in the clinic. We need to talk. Here's your heart health homework, and I'm serious as a heart attack about this, pun intended. If you're dealing with loud, irregular snoring with gasping or choking sounds, you need to pay attention immediately. We're not talking about gentle purring here. We're talking about sounds that would make a construction site seem peaceful. Morning headaches that feel like someone used your skull as a drum set, daytime fatigue that hits you like a ton of bricks, and mood changes that make you grumpier than a bear with a toothache. These are red flags waving harder than fans at a football game. The beautiful thing is that sleep studies can diagnose this problem before your heart takes a permanent vacation. Treatment options range from simple lifestyle changes all the way up to CPAP devices that work like personal air traffic controllers for your breathing. Here's what I want you to do tonight, and I mean tonight. Grab your phone, open up that voice recorder app, and record your snoring. If you hear gasping or stopping sounds when you play it back, schedule a sleep study this week. Not next month, not when you get around to it, this week. Your heart will thank you, your partner will thank you, and trust me, your future self will definitely thank you. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.